if I could. And I would also like to welcome Chief Lori Carr, who has been gracious enough to be here with us today. And I would hope you say a few words to us.
I would love to. Thank you. Be glad.
Be glad.
Sorry, I'll stand behind Katie and find the front spot when you're in circle. But Annie, Atikdodam, Majijakdodam, Megasekwadidvikas, Lori Nelson, Dichisabi, Initiative Thou. So good afternoon, everyone. What I said in introducing myself in our language was that I am from the Hoof clan, and I'm related to the Crane clan on my mother's side. I am my Anishinaabe name is Eagle Woman. My English name is Lori, and I am chief of our community of Highland First Nation. And I wanted to provide this little welcome. So miigwech for asking me and Katie asking me to be able to come in and first say congratulations on the amalgamation. That's a process, and I know it's a continued process that will happen, but it's a great first step. And putting everyone in a room together and coming from two separate organizations, but all having the same outcomes, and that's the health of all our peoples. And looking and doing that work that has to happen. I understand you also had the Sweet Brave teaching from Katie, so that's a wonderful teaching about coming together and the talking about mind, body, and soul with the sweet grass braid, and also that it's about love and harmony and kindness, and remembering those teachings as we come together and have our meetings, or you have your meetings. And I also wanted to just acknowledge the work that you do in the area of health. At one point, I had met with the Minister of Health many years ago in 2007 or 8 with Dr. Humphreys and Chief Knott, and we met at the old building. And we had talked about our community's health, First Nations health. And we know that First Nations health is below the average health of the general Canadian population. We know that there's data on that. But what is also part of that is when we talk about data, and I have to use my hands because I'm not the expert. So, but when we talk about data, and the way that it's measured, and how it starts to get measured. It's measured, say, at a level, this level right here, and how you ask your questions and what you do, and how you gather that data. But what's not measured is that we're First Nations health is still well below that beginning measurement. So to get our First Nation health up to even that equal that level of starting measurement, we have to find out how we do that. And we did talk to Dr. Piggott about that. How do we do that? How do we measure so that we can bring our health up to even just where the measurement starts on data? And so that's the important part of the work. And you're aware, the statistics are there, the data's there. You're aware that, the high rates of diabetes, the more susceptible we are. The first case of diabetes wasn't measured in First Nations people until 1950. It's not that long ago. And so it's those pieces of how our health changed and how we can work together as a public health and having our rep. And Katie does a wonderful job for us. And our people at the board. And so we're really grateful to her, but how we can do those pieces together and be inclusive of all of us. And what I really noticed over the last few years, especially during COVID and during these times of addictions and homelessness, is that the general Canadian population is now facing what we have faced for hundreds of years. And so it brings to that, we know how to help with that because we've been dealing with that for such a long time, much longer than yourselves have. And so that's that part again of working together, of braiding that sweet grass, of coming together and making this all work so that we all live. We call it Manoba Mazuin, the good life. And we all need to live that good life so we can move forward on, in, you know, as we talk about our, environments and our mother, we say our mother. And we talk about living on these lands together and these waters together. It's all interconnected. It's all, you know, this isn't just First Nations issues. It's all our issues because we all have 7 generations to come. And so how do we do that? And one piece of that, one big piece of that is right here at this table, working together to create health and preventive measures for all of our people to live Minopumazuan for a long time. So I just wanted to again say congratulations and say a few words. And thank you for meeting here today. And I hope you enjoy your time here and be able to take a little tour of the community after. We're very proud of our community and take pride in showing it off. So Miigwech, thank you, and enjoy your day and your meeting.
Thank you. Before you go, first off, I would really like to thank you for being here, taking the time. I'm sure you have a busy day soon as we do.
You know.
We just have a very small, just token of our appreciation.
Thank you so much.
Thank you for that.
Oh, be glad.
And your words were absolutely.
Thank you. Thank you.
Your words were absolutely truthful. The thing about an amalgamation is when you're amalgamating groups of people together into a common cause who may or may not have differences when they started. It seems to me that as we're progressing through this thing, we're becoming more and more conscious of the common goals that we all have. And the ones that you have mentioned are by our, not the least. They are probably the most. And so hopefully what we'll be able to do is to live up to the expectation and deliver on the goods that are needed to make all this happen. And so thank you very, very much for allowing us to be here today.
Thank you. Thank you for coming. Thank you.
So next item on the list, are there any declarations of conflict of interest or general nature thereof? Seeing none, we're good to go. Adoption of the agenda. Are there any amendments or changes that you think should be made to the agenda as presented? Seeing none, I'd like to have a motion to approve the agenda as circulated. So that motion that the agenda be approved. Have a mover, Doctor, and I'm going to get this right, Doctor. I want to pronounce it, but I will do it right. Makija?
Right.
And seconded by Councillor Rhea. All in favor? Motion carried. Adoption of the regular minutes from the April 16th, 2025. Does anybody have any obvious errors or changes that should be made to those minutes? Seeing none, can we make a motion to adopt the minutes of the meeting from April the 16th, 2025? I need a mover. Mayor Logal, seconded by Mr. Marshall. All in favor? Carried. At this point in time, we're going to go to 6, which is, I'm going to defer this to Dr. Piggott, who's going to give us some information about the Alpha membership.
Yeah, thank you. Through you, Councillor Rao. The follow-up was on the Alpha membership, which you'll recall Deputy Mayor Black had raised some questions of, and we met with Alpha. There was an explanation of the structure of the membership fees that was satisfactory, so that's been paid. That's the update.
You
Go through your question.
Yeah, can you elaborate on that? Like,
I think perhaps we can take that for another.
I'm gonna say Dr. Black.
Yeah, Deputy Mayor Black. Yeah.
He trying to remember exactly.
Yeah. So
It said, but
the concern was around a lack of public
Right.
transparency in how our new merged health unit membership fee was set. And so in a camera communication to us, they explained the structure of that fee. So I probably shouldn't disclose that here at our meeting, but I think he'd be happy to take questions if you have any, and or we could bring it back to a subsequent meeting. But the motion at the last meeting was to pay that membership fee pending satisfactory answer communicated to Deputy Mayor Black and myself, and we had that meeting and that was communicated and it was satisfactory.
Okay, I would still like to know how they come about it.
Yeah.
I
Understood.
recognize this discussed this camera at that meeting.
Yeah.
I think it should be fully disclosed to everyone.
We'll take that away.
Any further questions? Seeing none, can we have a motion to accept the information? I'm looking for the board. Can I have Mayor Ankevsky? Will I get that right? And can I have Dr. Stelzer? All in favor? Motion carried. Do we have any items for new business? Oh, we have nothing for consent. Oh, we're way up here. Ron knows to read this most of the time. Let's try this again, one more time. Now we'll have the Dr. Pickett's report from the medical officer of health.
Thank you. So not a lot of new information to report today. Our merger work continues to be planned well. The content of the retreat was very much appreciated at the start of May for informing some of the ongoing planning discussions, some of the planning around future board reporting on the merger and generally. So staff met and discussed the feedback of the retreat. The retreat overall was really well rated by board members who completed the survey. So thanks for sharing that. There's definitely a couple of suggestions around constructive input that we can take away for future planning, but generally people appreciated the location, the timing, the nature of the content. A few things people felt could have used a little bit more time and discussion, and certainly headed into the fall, we'll take that under account in planning some additional time together as a board. The other couple of pieces I wanted to mention is obviously a big thank you to Councillor Wilson for arranging and welcoming us to Hiawatha First Nation for the meeting today and for the delicious lunch. And I also want to wish them the very best in their powwow, which is coming up this weekend, which is very important weekend for them. So hopefully good weather and a great powwow. The last piece is Dr. Bocking and I just wanted to provide an update on measles. So I will turn it over to Dr. Bocking for that communication.
Great, thank you. Good afternoon, everyone. I'll keep this brief. You are likely aware from general media sources that the outbreak of measles in Ontario is continuing. So over the last 2 to 3 weeks, on a weekly basis, we're seeing anywhere from 150 to 200 new cases per week across the province. So the majority of those cases are associated with one outbreak that started last fall and is continuing to this date. Within that outbreak, we are now at a total of 1,622 cases in Ontario, only associated with that outbreak. 94% of cases in that outbreak either have not been vaccinated at all or have an unknown immunization status. So this is an outbreak that is impacting people that are not vaccinated and not protected against the measles virus. Unfortunately, today there's been 119 hospital admissions associated with this outbreak. So this is a pretty significant number for our region and the province overall. The majority of cases continue to be in southwestern Ontario, with Southwestern Public Health, Huron-Perth Public Health, Grand Erie Public Health being impacted primarily or more so than other health units. And you can imagine, especially in our rural areas,
smaller hospitals having to manage with the workload associated with emergency department visits, laboratory investigations, imaging, and hospital admissions, and the additional workload on the health system associated with the outbreak. We have not had a case across City of Court Lakes, counties of Northumberland, Haliburton, and Peterborough, or City of Peterborough. I think we should not be surprised if we do see a case. We certainly have had individuals that have been exposed if there are attending gatherings in other jurisdictions where a case has been identified. And so at the health unit, we continue to plan and prepare for when a case may or will likely arise at that point in time. We're continuing to put out public media messages on both our websites as well as through social media. We're making direct contact with groups that are more likely to see at least groups of children. So for example, our region hosts a large number of recreational summer camps in the summer. So information getting out to camp operators to ensure that they're aware of how to protect campers and staff, and also aware of what would happen should there be a case of measles arise during the summer. Because although staff members, it might not be required to provide proof of vaccination, operations will be significantly impacted if people don't have access to their records of vaccination to be able to demonstrate immunity to measles. So if there's one thing I think I could ask all members of the Board of Health to do when you're speaking with your counterparts or members of the public and residents, is to continue to promote vaccination as the most important way to prevent measles infection. We know that we actually have relatively good coverage against measles virus in terms of vaccination coverage in our region, but there are still pockets and there are still families that may not have had access or have chosen not to be vaccinated. And so I think everything that we can do as a community to support that goes a long way. I'm happy to answer if there's any specific questions.
Yes, I've been asked, I was immunized as a child. I'm an adult now. Should I be getting a boost?
So in general, we consider people born before 1970 to be immune to measles because the prevalence of measles at that time was quite high. And so if you've had measles infection, you're presumed to be immune to it. Full measles vaccine coverage, 2 doses, didn't start until the late 1990s. So there might be a small portion of the public that only received 1 dose of the measles vaccine, or it's the MMR vaccine. It includes measles, mumps, and rubella. So if people only have a history of 1 dose of MMR, they're absolutely recommended to get a second dose. If they're unsure if they've had measles or unsure if they've been vaccinated, then they can ask their healthcare provider to get another dose. If they've already had 2 doses, then it would not be our top priority, and we'd be recommending that our resources are focused on those people that absolutely need full protection.
Should we announce that through what you just described through our communications, or has that already happened and I just missed it?
So we do have information on the websites associated with exactly what I just said, and we have a recent promotional video that we're putting out that talks about vaccination, put up through our social media, so we can go back and look at what we have available and make sure it's answering the questions that are being asked.
To follow up on that question, if you don't mind me asking, we're doing that now, still twinning it on the websites for both the PPH and the HKPR. So until you get that right.
There's still 2 separate websites, and we're trying to ensure that there's consistent information across both of those sites, the same information.
Yeah, thank you. Yes.
Chair, just a quick question. What age group is typically targeted for the MMR vaccine? I remember as a child kind of thing. Is it still a certain age group?
So every province sets its own immunization schedule. So it depends on what province you're in. We're in Ontario, so first dose is around 12 months. So recommended between 12 and 18 months. The second dose is recommended a booster dose between ages 4 and 6. Ideally to have the second dose before starting school. We check records by the time the child is 7 years old.
Thank you.
Dr. Piggott?
And maybe if I can just add, in the context of the outbreak we're in Ontario, especially those southwestern Ontario communities, there's sort of special enhanced outbreak guidance. And one of the things that can entail is children as young as 6 months being vaccinated with the vaccine. They still need to get immunized again later after a year, but it is safe and effective protection for kids as young as 6 months. That's been a question we've received as well. Yeah.
Mr. Chair, Dr. Walking, I assume that they have found out the cause of this. And so what are they moving forward? What are they going to do to prevent this happening again?
Well, I think there's multiple causes and things coalesced at a time where our overall vaccination coverage was lower because of the pandemic. There were many children that weren't able to access routine vaccinations. Globally, we saw a surge of measles infection, again, largely related to there being a decrease in vaccination throughout the pandemic. So when you have international travel to areas where measles is still endemic, so it still circulates routinely, you come back to Canada and you're back in a population where the fewer people have been vaccinated and they're more susceptible, then that starts an outbreak that becomes very hard to contain. So there are things that we can do. What we can do to prevent it is ensure that we are maintaining our population coverage for vaccination, and we do that by both enforcement of the Immunization of School Pupils Act and ensuring people have access to childhood vaccines. We can encourage that if people are traveling internationally, that they're protected. And as Dr. Piggott was just saying, so for infants, even as young as 6 months old, if they're traveling to an area where we know measles is circulating, they can actually get immunized ahead of time so that they won't be exposed and become infected and come to Canada and start something here. So I think there are lessons learned, but through a number of things that coincided at the same time, you had the perfect hinder to start really an outbreak that has continued.
Thank you.
Dr.
Thank you. Dr. Bocking, I may be a little bit, but I can remember measles. I always thought it was kind of go along with flu, so it would happen more in the winter and that type of stuff, but it doesn't sound like that's what you're telling us.
But I think measles has been eliminated in Canada since 97, around in the 1990s. So that means when it's eliminated, it doesn't circulate on its own here. The only cases of measles we've been seeing are those associated with international travel. So when it's not here, we don't have the seasonal patterns. So what we're seeing now is associated with the specific outbreak, and it doesn't care about what season it is right now.
Thank you.
I have one question, if you don't mind. Are we getting a large number of people who are rejecting, technically, legally, practically not so smart, maybe, the need to have their children vaccinated? Is a very small percentage of people that are choosing not to go there.
So the information that we have, or the data that we have, is when we enforce the Immunization of School Pupils Act. So when we check all 7-year-olds, if they have either provided proof of vaccination or they have applied for an exemption to that. So the proportion of children or families that apply for an exemption is actually relatively small, which is why our coverage for 7-year-olds is hovering around 90%, and for 17-year-olds it's actually closer to 95%. So it is there. We do have pockets of the population that don't support vaccination or for other reasons choose not to be vaccinated, but it is a relatively small number.
Any further comments or questions? Seeing none, can I have a motion to receive the update for this information? Dr. Makija, seconded by Mayor Lowell. All in favor? Carried. At this point in time, there are no consent items, so we will move on to the next item. And that is a report from Dr. Piggott on the actual policies that we're going to be talking about today.
Reports, yeah. So we have two policies to review today. Again, to contextualize this, the process was to set a schedule and start to bring bylaws and policies to the board. January 2nd, we had all the must-haves right at the start, and now we're working our way through. The process for each policy is we look at the legacy organization policies. We've had a legal review and in some cases drafted new policies or adapted existing policies to ensure legislative compliance. And so we have two new policies new to this board to approve today. The first is on board leadership and committee membership selection. And this is a policy that is adapted from Legacy Peterborough Public Health because the committee membership piece was relevant there. And the second policy relates to health and safety. And it is a fairly straightforward policy to note and ensure that the board is compliant with applicable legislation on health and safety. So we'll take 9.1 and happy to answer any questions if there's questions on the policies. And then there's another report for 9.2.
Any questions on the first one? Comments?
Fairly straightforward.
I just have one, in cases where we have elections, and this is in the year 2026. Some of us, like for instance, the election is in October. We don't have our first meeting of our new council until December for the most part, because we finish off in November. Because we are a two-tier system, we also elect our warden. And our warden has the final say on who actually represents us at various committees, especially if they're external. It doesn't create a big problem when you've got returning people that are going to come in and do the same thing. But in the event that you don't, if someone either chooses not to want the job or doesn't run again, you've got the problem. Because you're asking here, sort of like in December, that we have some kind of an answer. For us, it's normally the first or second week in January when our warden finalizes everything. So does that give us the opportunity to have somebody like a delegation subject to approval, or how I don't want to change the bylaw. I just want to understand how it can be used when you're in a situation like we only for 2026.
Yeah, so I mean, and it is every 4 years or 2 to 3 years, depending on the First Nation context as well. So election years are covered off in item 2 under the policy. And, generally, again, as a policy, it's meant to assume most eventualities. And there are always situations where something goes longer, it takes more time, needs some other consideration. But the Board of Health needs to continue to exist despite the election. So there are appointees from the province, there are appointees from each municipality, First Nations, and the board exists with whomever it does while those people are formally appointed. So I think that we are covered off. The context of selection of a chair, vice chair is a little bit unique, and the way that has been handled from a Peterborough Public Health standpoint before is if there is somebody who's sitting in one of those leadership positions in an election year who's not seeking re-election or who does not successfully become re-elected, the board would appoint somebody new at that moment as chair for the rest of the year, or possibly appoint somebody new as chair for the next year early. So I think there are a few ways that it can be handled, but because there's a bunch of permutations, I think the policy is vague and broad enough that it covers us. I'm not sure if I've answered your question.
I think you have. I think what you're also saying too is that because of timing in how we do business at an individual level, we can appoint someone to represent us until we finally approve the person who's going to represent us. Therefore, we're not holding anything up. Is that right?
Totally, yeah. And the process that's used at each municipality or First Nation for appointment is different in some instances, and that can change at any moment, right? Okay. That could change with council direction from one meeting to another, theoretically, right? From the Board of Health standpoint, you probably have your own processes in place at each municipality or First Nation.
Okay. So do we want to pass a motion on this particular one, or do you want to cover the second one and then pass them both at the same time?
We can take them together, right?
Okay. So are any further questions on this particular policy? Seeing none, can we now move on to the second policy? Health and kid safety.
Right. So nothing to add from what I commented earlier. This is a simple policy to make sure that we're the board's legislative compliance with occupational health and safety legislation is there. So it's a pretty straightforward one, but a legally required policy.
Any questions or comments?
This is just really, something that applies mostly to employees, right?
The legislation?
Yeah.
Yeah, it would be for,
Protect our employees.
yes, it's health and safety of our employees and as an employer legislative responsibility.
Dr. Bigot, in our capacity as board members, technically, are we not also, for that purpose, employees and must follow these rules?
Enough. Matthew knows the answer.
Yeah, the language legislation doesn't tends not to use employee, they use worker, which is a little more inclusive and allows for latitude for contractors or folks who are working on behalf of the organization.
So that would include us. Any further questions, comments? Seeing none, can we have a motion to accept the two Board of Health policies? That would be the board leadership and committee membership selection and the health and safety. Even mover in a second. Now I'm going to get this right, so help me God to get it right. It is La Chica. Councilor La Chica. Seconded by Councilor Richardson. All in favor? Carried. We're also now going to be moving on to the next item, which is a report on the formation of a governance work group. So Dr. Pickett, could you brief us on that?
Yes, thank you. So through you, the board recently at the retreat talked about a skills matrix. As you'll be aware, there's an interest in the province in hearing whether future provincial appointees and the appointment process that they utilize might be informed by what the Board of Health sees as potential skills that we're seeking. And so for that reason, there's a bit of a time crunch to take what we talked about at the retreat, which was draft categories for Board of Health skills. There was 2 new skills that were suggested in those conversations, so those have been added to that matrix. And we're going to move forward to have you complete a survey assessing. It's a self-report survey, assessing yourself around your comfort competency with those skills. And we would like to have a subgroup or a working group of the Board of Health support that review, as well as to support the eventual potential call for interest from the public for appointees to the Board of Health that we don't have the final say, but we might write letters of support for individuals. It could include letters of support for reappointment for existing provincial appointees. And it could also include findings on the skills matrix around gaps on the board, which might inform future development opportunities if we have, a workshop or session or education session around some of the identified gaps. So to inform that, in lieu of the full board managing a process, we're thinking we probably need 2 or 3 meetings of a working group. And we were hoping to have, we were thinking between 3 to 5 members. And obviously a diversity of perspectives would be important. Given that one of the items of work will be reviewing current provincial appointments, I think important to think about that as a potential lens for who is interested in this. And I think the scope that we've articulated has 4 objectives here. And we aren't looking for hands and interest at this moment, but Alita will send a follow-up today or tomorrow, and we can look for interested individuals. Again, 3 to 5 people meeting 2 to 3 times, we think. over the next few months, including potentially if we can make some time around the summer, because the province has articulated if we want to provide information, we need to do that to them before the end of the summer. So we will have the working group report back on the skills matrix and its findings and kind of next steps to the full board, but we'll be looking for help from the working group.
Any questions or comments on that? But just a question, Dr. Piggott, you're seeing, this is a limited time committee,
Yeah.
right? So we're only going to run it for a certain period of time, and then once we get
So working
organized,
yeah.
it may or may not happen after the next election, depending on what comes out of it.
So I would, instead of a committee, I would contextualize as a working group that, won't have decisional authority and won't make recommendations, may make recommendations to the board, but the board ultimately, if there are letters of support to write or any other motions, actions out of the working group work, it'll come back to the board. But yeah, I think it'll be a time limited one-off. Perhaps this is done again in the future in some way, but several meetings, 2 to 3 meetings over the next few months, and then disband itself.
Do you foresee, but I think we need to test this out first, which would be the first thing to do, but do you see the need for possibly a policy going forward if we were to use it again?
We could consider that. Yeah, I think maybe that could be part of the conversation at the working group level. This is a bit of a unique time for a new board in reflecting on skills that are here and skills that would be desirable. There's conversations at the retreat about, for example, would legal expertise be something that the board would benefit from as a skill? I'm just throwing out there's about 13 or 14 skills. So I think in seeing the heat map that's created from the skills matrix and in seeing where our strengths are, where potential gaps are, there may be some obvious areas, and that could again inform a call for interest, which we've done, that boards have done historically, have put a public call out to the community for people interested in joining the Board of Health. That is a process where because the province ultimately through their public appointment secretariat is responsible for appointing. So if people express interest from the public, we can help them through the provincial appointment process and form submission, but then the board could consider writing a letter of support, which may or may not have influence with the provincial government in the final appointment decisions.
Any further questions or comments? Seeing none, can I have a motion to approve the establishment of a time-limited governance working group? Need a mover? Yeah?
On your screen.
Oh, yes, Mayor. Seconded by
I'll second it.
Dan, okay. That would be Councillor Joyce. All in favor? Here. I would now move on to 9.3, which is the report on Indigenous Health Advisory Circles. Dr. Piggott, it's your show, sir.
Thanks. So just for your information, the report back from the last Indigenous Health Advisory Circle meeting, and I draw attention to the interim guidance that was provided on land acknowledgements that will be relevant to the Board of Health and to staff. And so there are 3 considerations for land acknowledgements that were provided by the Indigenous Health Advisory Circle. One was authenticity, starting out with good intentions, a good heart, saying your words with and thoughts and kindness is what matters most. Land and place, acknowledge the natural land and waters, research the specific Indigenous nations and relevant specific treaties of the area you're in, and share a personal reflection, learning, or personal understanding to demonstrate continuous growth and a willingness to build meaningful relationships with Indigenous communities. This might specifically include a teaching or a lesson that you learn. So the Indigenous Health Advisory Circle has interest in creating a cultural protocol policy more broadly that would eventually include a more formal land acknowledgement policy or approach. But this is the interim guidance from the circle in the meantime. So this is just simply for information, to receive for information.
Okay, yes.
Through you, Chair, just regarding the minutes of the Indigenous Health Advisory Committee, I will present the minutes and list if it's that. Thank you.
Okay. Any other comments or comments? Seeing none, can I have a motion to receive the two items for this information? The IHAC meeting minutes from February the 28th and the intern guidance requiring regarding land acknowledgements. All and Mayor Vogel. All in favor? Carried. So we have no consent items to deal with this time around. Are there any items we would consider for new business? None up there, none in here. Seeing none, we have no correspondence at this time. And that brings us down to the in-camera session. So can I have a motion to proceed to in-camera to discuss 5 items in accordance with the municipal act? Various expectations are noted in the agenda package. Councilor Real, seconded by Dr. Matija. We need to have a motion to adjourn the session
And
and rise to report, all in one shot.
Yeah.
Very good. Katie and Paul. All in favor? Carried. Now we're in open session.
yeah, now we can pass this.
Are we straight?
Yes, we are.
Cool, wonderful. So with that in mind, I'd like to make move a motion that that the Board of Health of the Halbert, Corinth, and Summerlin, and Peterborough health units receive the following items for information. So in camera, item 5.1, confidential update pertaining to exception section 239 2D. In camera, section item 6.1, confidential update pertaining to exception section 239 2J. In camera, item 6.2, confidential update pertaining to exception section 239 2D. In camera, item 6.3, confidential update pertaining to exception 239 2D. And in camera, item 6.4, confidential item update pertaining to exception section 239 3.1. We have a movement, please. Joy, we'll use first names. And doctor, I'm having a problem. I'm gonna do this one more time. Dr. Makisha.
Right.
Very good. All in favor? Here. That leaves us with the next date, which at this point in time would be Wednesday, June the 18th, from 5 to 7. And it would be at 185 King Street in Peterborough. That sounds about right. One. Now, can I have a motion to adjourn? Katie and Councillor Joyce. All in favor? We're adjourned.
Thank you. Thank you.
Thank you.
Thank you.
Very good. Thank you very much. Very nice of you to put up with me.
Not.
I'm not the Paul.